Waterborne diseases are a significant global health concern, particularly in areas with limited access to safe drinking water and inadequate sanitation facilities. These diseases are caused by ingesting water contaminated with pathogens or toxins. 1. Cholera. Cholera is an acute diarrheal disease caused by the bacterium Vibrio cholerae. It spreads through the consumption of contaminated water or food. Cholera outbreaks can result in severe dehydration and can be fatal if left untreated. Lack of clean water and poor sanitation contribute to the spread of cholera in many parts of the world. 2. Typhoid fever. Typhoid fever is caused by the bacterium Salmonella typhi. It spreads through contaminated food or water contaminated by feces from an infected person. Symptoms include fever, headache, abdominal pain, and diarrhea. Without treatment, typhoid fever can lead to severe complications and even death. 3. Hepatitis A. Hepatitis A is a viral infection that affects the liver. It spreads through the consumption of water or food contaminated with the hepatitis A virus. Poor sanitation and inadequate hygiene practices contribute to the transmission of this disease. Symptoms include jaundice, fatigue, abdominal pain, and fever. 4. Amoebic dysentery. Amoebic dysentery, caused by the parasite Entamoeba histolytica, leads to severe diarrhea with blood and mucus. It spreads through the ingestion of contaminated food or water. Poor sanitation and unhygienic practices contribute to the prevalence of this disease, particularly in areas with inadequate water and sanitation facilities. 5. Giardiasis. Giardiasis is caused by the parasite Giardia lamblia. It spreads through the ingestion of water or food contaminated with the parasite. The disease results in diarrhea, abdominal cramps, bloating, and weight loss. Poor sanitation, unsafe drinking water, and improper hygiene practices contribute to its transmission. 6. Cryptosporidiosis. Cryptosporidiosis is caused by the parasite Cryptosporidium. It spreads through the ingestion of water or food contaminated with the parasite. Symptoms include diarrhea, stomach cramps, nausea, and vomiting. Cryptosporidiosis can be particularly severe in individuals with weakened immune systems. 7. Dysentery. Shigellosis. Dysentery, specifically shigellosis, is caused by various species of the bacterium Shigella. It spreads through the consumption of water or food contaminated by feces from an infected person. Symptoms include bloody diarrhea, abdominal cramps, and fever. Poor sanitation and unhygienic practices contribute to its transmission. 8. E. coli infections. Escherichia coli, E. coli. Infections can result from consuming water or food contaminated with certain strains of the bacteria. Some strains produce toxins that cause severe gastrointestinal illness. Symptoms include diarrhea, abdominal cramps, and sometimes bloody stools. 9. Legionnaire's disease. Legionnaire's disease is caused by the bacterium Legionella pneumophila. It spreads through the inhalation of water droplets contaminated with the bacteria, such as those from hot tubs, cooling towers, or plumbing systems. Symptoms include high fever, cough, and pneumonia-like symptoms. It can be severe, especially in individuals with weakened immune systems. 10. Guinea worm disease. Guinea worm disease, or dracunculiasis, is caused by the parasitic worm Dracunculus medinensis. It spreads through the ingestion of water contaminated with tiny water fleas carrying the parasite's larva. Once ingested, the larvae mature and emerge as long, painful blisters on the skin. Guinea worm disease is on the verge of eradication, thanks to global efforts. Preventing waterborne diseases involves ensuring access to safe drinking water, improving sanitation infrastructure, promoting hygiene practices, and raising awareness about the importance of clean water and sanitation. Public health interventions, such as water treatment, proper waste disposal, and vaccination programs, play a crucial role in reducing the burden of waterborne diseases worldwide.